that medical care is the biggest thing that our provincial taxes buy. And I think that's what makes it all the more frustrating when so many of us struggle to get access to timely care, even as our provincial medical budgets reach record levels. And so I wanted my report to try and unpack why is this happening? And I started with an observation that I think is going to surprise listeners. Over the last 50 years, our province's population has a little more than doubled. I think it'll surprise listeners to know, though, that the number of physicians has nearly quadrupled. And that seems really paradoxical in a country consumed by the idea of a doctor shortage. And so I wanted to try and wrestle and showcase for people why I thought we could unravel that paradox.
All right, so help unravel it for us, why don't you? What did you find?
So I think a big part of the answer rests in the fact that our population isn't just bigger, it's also older. Back in 1976, about 1 in 10 British Columbians was over age 64. Now it's 1 in 5. And that really matters because when we are over age 65, we are going to use on average as much medical care as 4 people under age 50 combined. And so we know that as the baby boom was moving through its working years into its retirement years, our demand on the medical care system was going to grow dramatically. And let me put that into context. The difference between having 10 and 20% of our population as seniors today is equivalent to adding an extra 2.5 million patients under the age of 50 in line for care in British Columbia at this moment. And so that absolutely is contributing to rising wait times to get access to our doctors. But what I didn't expect is that actually the number of doctors has even kept pace with the demand being driven by the aging of the population. And that leaves a gap in our understanding about access issues that is more than just about coming up with the cost to cover baby boomers' aging medical care. It's also to talk about how do we invite doctors to reflect on this question of why, if there are so many more of you, is it more challenging to access you?
Okay, well, what about those gaps in access issues then? I know a whole lot of people who are in search of a regular, family doctor, GP, what is blocking people's access to doctors?
Well, part of the explanation lies in how medical work has changed. Like the physician headcount has surged, but total physician hours have grown more slowly. Quite a lot of research now shows that doctors today work fewer weekly hours, fewer annual hours than they did many decades ago. And that's partly about wanting better work-life balance, especially as more doctors today are part of dual earner households. They don't have like a spouse at home, to manage everything else. We also know that there are some staffing incentives that create some perverse outcomes. Hospital roles often offer family physicians better pay and less administrative work. And actually, hospital managers kind of like it sometimes when physicians take on work rather than nurses because physicians will bill the provincial health system directly, whereas hospitals have to pay for nurses out of their budget. So there's some incentives there that, merit some consideration and review. But we do have this big challenge of just a funding shortfall in some regards. If you were to have in BC the same age distribution now as when baby boomers were young, in other words, if we had just 1 in 10 people over 65, not 1 in 5, then BC would be spending $8 billion less today on medical care. That would wipe out in one moment 3/4 of the provincial deficit if nothing else changed in the provincial government spending or tax patterns. And so that's a funding pressure that governments are needing to pick up today, even though we knew that pressure was coming decades ago. And one way I know that we knew that is back in the mid 1990s, our federal government said, baby boomers, we need you to pay 68% more in your CPP premiums, your Canada pension premiums, so that when you retire, there will be a surplus to draw down and the Canada pension plan won't go bankrupt. Our provinces needed to do the same thing for medical care, and they didn't. And now we are all struggling with the outcome, especially those of us wanting to find a doctor, access a doctor, and also in terms of just the costs it requires.
Okay, so what do we do with this information? How do we
How
address
do we,
the
yeah, how
long
do we move
wait
forward?
times? Yeah.
Well, I think two things matter. First, we need to have a conversation about better late than never. We should have adapted decades ago to the pressures of an aging population. We didn't. It's late, but not too late to adapt now. And this is inevitably going to have a kind of hard truth conversation with the financially secure older people in our lives who we're going to have to say the rules back in the day didn't have you contribute as much as to the medical care cost as you are now going to demand. And how are we going to reconcile that so that we don't leave large unpaid bills for those who follow and crowd out investment in the things that make people healthy, like affordable housing and poverty reduction and childcare? But we find it hard to get to that conversation because we keep being distracted by this oversimplified myth of a doctor shortage, which then often takes us down a road to a conversation like the answer is to pay doctors more so they, will come work here as opposed to somewhere else. That is not really the right way to frame the conversation any longer. And we need to move from a shortage of doctors to like, we have more doctors than we did in the past, more than actually relative to demand on medical care. And now the conversation needs to be with doctors. Why is it hard to have you available in the right places at the right times when people need you? And that's a different conversation than a doctor shortage. And it's certainly not one that starts only with the question of remunerating doctors, as opposed to some of the other issues that we talked about earlier in the interview.
Okay, can this be addressed, you think, with a reasonable time frame? You already said better late than never, but I mean, what if this isn't addressed soon?
It has to be. It's at issue is maintaining universal access to our medical care system. We see in our neighboring province, Alberta, where they're talking about, oh, maybe the problem is we need to be providing people more access to the private system and having doctors work in the private and public simultaneously. We've never talked that way before. That creates new risks and challenges. You see in Quebec, they're saying, doctors, we need to mandate you to see more patients. That's sort of in line with the idea that, doctors' numbers have kept pace, but their hours haven't necessarily, and their service hasn't necessarily. And at bottom, we need baby boomers to wrestle, especially those who are financially secure. We can never say to a poor retiree, you can't access the medical system. We cannot say that to anybody. But those who are financially secure, we will have to have this challenging conversation. Our governments didn't ask you to contribute enough taxes during your working years to cover the medical care you're now going to use. And this is really straining the system and leaving significant challenges for those who are following in your footsteps in terms of covering those costs and also having investments in the things that make their own standard of living and their own health promotion urgently invested in.
Well, you've given us lots to chew on, Paul, as usual. It'll be interesting to get some reaction from doctors on this one. But thanks very much for taking us through it.
My pleasure. It's the beginning of a hard truth conversation. It's not one we're going to resolve right away, but we have to do it in the relatively short order if we're going to preserve universal access to this medical system we all treasure.
Thanks again. That is Paul Kershaw, the professor of population and public health at the University of British Columbia. He's also the founder of Generation Squeeze. If you are a doctor, a medical professional, work with a medical organization, what do you think of what Paul had to say, that we really don't have a shortage of doctors? Love to get your reaction to that conversation on the coast at cbc.ca.